Healthcare policy and undocumented immigrants. Should we create policies to support healthcare for undocumented immigrants in the United States? The problem. Although the number of people without health insurance has drastically declined since the Affordable Care Act, ACA, was implemented, undocumented immigrants are still excluded from many health coverage options under ACA. One study in California showed that approximately 1.8 million people in this state are projected to remain uninsured because of their immigration status. Limited access to quality health care increases health vulnerability due to low income and occupational status. Further, the stressors associated with having undocumented status may eliminate the health advantage of the undocumented at a quicker rate than their undocumented counterparts. Undocumented immigrants with chronic and infectious diseases are at a disadvantage because of poor access to health care. These health conditions can progress without detection or treatment because of immigrants' limited health care access. Policies to address the problem. Should we create policies to support healthcare for undocumented immigrants in the United States? Yes. We should design a program that focuses on those left out of healthcare reform, including U.S. citizens and permanent residents, that will also benefit undocumented immigrants. The stakeholders affected are state healthcare systems, area hospital, local public health system, undocumented immigrants, U.S. Department of Health and Human Services, and taxpayers. There are approximately 11.5 million undocumented immigrants in the United States. 68% of illegal immigrants lack health care coverage. As a result, they must seek emergency care under the Emergency Medical Treatment and Active Labor Act, EMTALA, which requires hospitals to treat all patients in emergency situations, including undocumented immigrants. Since the enactment of EMTALA in 1986, the Federation for American Immigration Reform, FAIR, estimates that states have spent $22.9 billion annually on healthcare costs for undocumented immigrants. Although there is no law requiring this extension of health benefits to undocumented immigrants, refusing healthcare to these people does not represent the best public policy. Allowing undocumented immigrants access to quality health care would decrease the cost for all taxpayers by decreasing public expenditures. A study done at the University of Arizona's Udall Center in 2001 estimated that the approximately 46 million uninsured individuals cost the U.S. economy $38 billion each year in uncompensated healthcare costs. Studies done in individual states have shown that undocumented immigrants cost their respective states amounts ranging from $17 million in Minnesota to $1.4 billion in California each year. While it may seem counterintuitive to reduce costs by extending healthcare coverage to this population, the long-term cost reduction will exceed the short-term expenditure required to extend Medicaid services or other subsidies for private health insurance. By offering healthcare coverage, a preventative regimen will begin to take effect, meaning the progression of an illness to a more advanced stage will be slowed or halted altogether, and the cost will be allocated to cheaper preventative options instead of chronic illnesses. In addition, the absence of clear, affordable healthcare for illegal immigrants poses a health risk to the general population, taxpayers, U.S. citizens, with a threat of the spread of diseases. Because they are here illegally, they undergo no health screenings to ensure they are free of communicable diseases. Children born to these undocumented immigrants often receive no health care, no preventative care, no vaccines, meaning a resurgence of diseases that had been nearly eradicated from within the United States border. One example of this is the 2001 outbreak of tuberculosis traced back to Mexican undocumented immigrants. Issues with the current system. EMTALA requires emergency care to be provided. There is no care for chronic conditions. Hemodialysis is not covered, whereas emergency care for kidney crisis is covered. This forces patients to seek emergency care every week for a chronic condition. This is dangerous for the patient and expensive for taxpayers who would have to pick up the economic burden. What are benefits of providing healthcare to undocumented immigrants? The importance of healthcare for the undocumented immigrant is that access to care is a human right. Being healthy should not be a privilege. In 2013, there were an estimated 11.3 million undocumented immigrants in the United States without access to regular health care. Under the ACA, undocumented immigrants are excluded from participating in state exchange insurance markets, thus restricting their ability to access healthcare services. The only access to healthcare for the undocumented immigrant is the Emergency Medical Treatment and Labor Act, enacted in 1986. Offering healthcare to undocumented immigrants could save the United States an enormous amount of money on a yearly basis with primary and preventative care. Author DePetris pointed out in 2015 the importance of population safety. Proper access to healthcare assists in reducing infectious and communicable diseases in the population. According to Teneri in 2016, the annual costs for undocumented uninsured individuals are estimated at $4.3 billion. This is predominantly due to the use of emergency rooms and federally funded clinics. These numbers do not include the billions of dollars that are being soaked up by hospitals for inpatient and specialty care, which in turn shifts costs to taxpayers and uninsured. Currently, California and New York are spearheading ways to offer complete health care for undocumented immigrants. Whitman in 2015 discussed that advocates for immigrant health coverage report the amount of money spent on health care could be less inflated if undocumented immigrants had access to regular primary and preventative care. Allowing undocumented immigrants to gain affordable health insurance would be a benefit to the country's overall health and could render overall cost savings for the nation by reducing costly visits to the emergency rooms due to lack of primary care access. Policies allowing undocumented immigrants access to health care. Supplemental funding to hospitals that serve large numbers of undocumented immigrants is one option. Supplemental funding to migrant and community health centers for primary care is an additional option. Both of these can be expanded through increased funding for federally qualified community health centers, FQHCs, under the Affordable Care Act. Some city and county governments have implemented policies on the local level that have expanded coverage for undocumented immigrants. For example, Los Angeles County developed the Los Angeles Healthy Kids program to cover all uninsured low and middle income children up to 5 years old, including undocumented children. Funding for this program was provided by First 5 Los Angeles. This was funded by a statewide tobacco tax and several local foundations and health plans. This program was found to be effective at reducing unmet healthcare needs and improving the health status of uninsured children not eligible for Medicaid. While there's no actual financial breakdown, it has been noted that U.S. citizens' healthcare costs are higher than costs for non-citizen immigrants, and there are trivial differences in the percentage of respondents with at least one uncompensated care visit by immigration status. A fitting example would be lack of immunizations for illegal immigrants. Not providing them with immunizations would prove very costly in treating outbreaks of diseases for U.S. citizens. In conclusion, allowing access to healthcare for undocumented immigrants can reduce the overall cost of taxpayers and the federal government by reducing costly emergency care. Having access to primary and preventative care with routine healthcare visits will reduce disease progression, reducing the cost of overall care. Providing healthcare for the undocumented immigrant population promotes better health for the entire population by decreasing the risk of transfer of communicable diseases. Healthcare is a human right that must be provided to all, regardless of immigration status.